Did you know that dry mouth can cause cavities? Saliva naturally washes away bacteria and food particles from your teeth and gums. Without that, all of that bacteria and all the food particles can stick to your gums. So if you're going through chemo like I am, it's important to make sure that you keep your mouth super clean. Make sure you're brushing your teeth regularly and flossing at least once a day. And make sure you brush your teeth before you go to bed. Use a non-alcohol based mouthwash. Dentist recommended Biotene, a Biotene mouth spray. It coats the inside of your mouth. So it helps reduce like the dry mouth feeling, but it also is just a mouthwash that's gentle and doesn't have any alcohol in it to irritate. Everything gets really inflamed in my mouth during chemo and my mouth really swells up. There's some gum sensitivity when I'm brushing my teeth even, so I have to be super careful on some days, like the week after chemo, things get really inflamed in my neck and everything in my head really. I can even feel like there's like a line on the inside of my gums, like my whole gums are so swollen that it presses into my teeth and makes like a print. During those days, I try to avoid any sharp foods, try to eat really soft foods so that I don't further inflame anything. I've heard about so many different kind of side effects you can have from chemo. Side effects hit everybody differently. Dental issues can be one of them because during chemo, your dentist may not work on your teeth. In fact, I had to reschedule my cleaning because my dentist wants a medical clearance from my oncologist before they'd even do a cleaning. Cleaning can also dig into your gums and pushes bacteria around that can get into your bloodstream. Talk to your dentist about your breast cancer. It sounds counterintuitive, but trust me, people talk about mouth sores. I think it might depend on what kind of chemo you're getting. I haven't had any, knock on wood, but there is a magic mouthwash you can get from oncologists if you do have that. When my mouth swells up, I have rinsed with a baking soda or salty water rinse, but I also did not do it last time and I didn't notice a difference. So I think the most important thing so far seems to be keeping your mouth clean. I also have not experienced any sort of metallic taste. People have been reporting that. I do have some taste bud changes during 2 weeks after my chemo. Like I think things don't taste right. So I'm very like food averse. I don't know if that's just like some things give me the ick or if it's really like my taste buds are affected. I know people have talked about that metallic taste and to switch to plastic silverware if you need to. I think metal could be Also, now I understand the hard candy thing. Sometimes you just have dry mouth and you're already drinking 4 liters of water a day, so you don't need any more water. Having something in your mouth to suck on, it can kind of get some of that ick and weird taste from your mouth, a dry mouth. Of course, if you're eating candy, make sure you're brushing your teeth so you don't get a cavity because the dentist will not be able to take care of you if you are under chemo. In fact, I was told by my dentist to reschedule after my chemo, get the medical clearance, and we'll do it in between chemo and radiation. Are there other weird mouth stuff that you've experienced and or heard about that you didn't experience, or are you experiencing any? Let me know in the comments and follow along for more tips.